Well, Dr. Levine, it is such a pleasure to meet you. In our field, you're one of the most prolific clinicians out there. It's a little similar to, and I'm Canadian, so I think of interviewing Wayne Gretzky in hockey. So for, you are just in terms of all the trainings, all of my, fellow clinicians in Canada want to take. Yours is one of the top. Like your model. So I'm just, yeah, it was just such an honor that you wanted to be on our podcast. We were a little blown away just because of how respected you are in our field, especially in Canada. We Canadians love you.
Well, that says something then.
Yes, we adore you.
I love
So
Canadians. So.
yeah, so I'm such a huge fan of your work. So I just want you to share a little bit about the way you work with trauma and how that's different than, say, eye movement desensitization or play therapy or cognitive behavioral therapy. You have a really unique and it's so revolutionary way of treating trauma. Can you tell us a little bit about that model?
Okay, well, let me start with this idea that two ideas. First one being that somatic experiencing isn't really a therapy in itself. I mean, yes, it can be, but it really helps people do what they do better, to to what they do, how they do, to how they do what they do. So it really is applicable to a wide spectrum of different therapeutic and healing modalities. The other thing that I think is important to understand is that trauma isn't so much, it's not just what happened to us, but rather what we hold inside in the absence of that empathetic other.
Mm.
And it's exactly so, it's not just about the event. Um, Also, when I started developing the beginnings of somatic experiencing in the late 1960s and then into the 1970s, um, I, uh, I was going to say unfortunately, but fortunately, the definition of trauma as PTSD was still another 12, 13 years in the future. And so I didn't know that trauma was supposedly an incurable brain disorder or even an incurable brain disease that could be at best managed by medications and by helping people change their negative thoughts. And I'm not against either of those, but that's really a very small part of what happens in trauma. And trauma is something that's not just in the brain. Of course, it's in the brain, it's in the mind, it's in the psyche, it's in the soul, but it's something that happens fundamentally in the body. So, for example, if you go outside today and you look outside and you see somebody's been injured, somebody's been hit by a car, and your guts go, ugh. And then as you look more closely, you see the person is really injured. So the brain knows to respond to injury in others with this kind of an alarm. So again, you get, oh. And what can happen is that can get stuck. So, for example, in this example, later on that day or at night when you're going to bed, all of a sudden you see images of the person laying there on the street. And so it's starting to replay itself. So again, I'm not saying this is not the biggest trauma, but it's a useful example. So anyhow, the guts stay in that clenched position, and that happens when we're traumatized, and of course to a much greater degree. But it's okay if I say a little neurobiological information that there's a nerve that connects mind and body, profoundly connects mind and body. It's called the vagus nerve, and it's a very primitive nerve. It's the largest nerve in the body, and it goes from the back of the brainstem down into below the diaphragm to all the organs, especially the gastrointestinal system, and also to the lungs and to the heart. Actually, Darwin in the 1860s wrote about this. He called it the pneumogastric nerve. And he realized that it was responsible, in his words, for gut wrench and heartbreak.
Mhm.
And so the question is, how do we get in and how do we change the information that's coming from the gut to the brain? So again, you see the injury, the the message comes from the brain down into the guts. The guts go yuck. That nerve is 80% afferent, it's 80% sensory. In other words, 80% of that largest nerve in the body is coming from the organs and is relayed back up to the brain, where it can get amplified. And so, if you're exposed to this kind of threat and injury over time, it can start to become chronic. And as it becomes more and more chronic, then often people develop symptoms like gastrointestinal problems, irritable bowel, and so forth. So again, they can lead to physical symptoms and they tend to reinforce and amplify themselves. So we want to be able to get a new signal coming from our guts up to our brains to say the threat is over, it's okay. Because when our body is in the past, our mind will continue to replay the past as though it's happening in the present.
Yeah.
So, um, yeah, go ahead.
Yeah, I would say I know a lot of people who I've treated in therapy have no autobiographical memory of the incident. Say it was pre-verbal, happened when they were very young. I know when parents bring me their kids, they'll say, I'll ask about like, how was your labor? What was birth like? What were the first couple years like? And they say, well, that doesn't really matter. My child won't remember that. And what would you
Right.
say to that when parents say, and I, of course, you can give the spiel. I have my spiel, but let's hear your spiel.
I would say your child will definitely remember it, not as a simple memory, as a declarative memory, but as a body memory, what's sometimes called a procedural memory, or also emotional memories. So all of a sudden, the child uh, has, in certain situations, an emotional outburst that just doesn't make sense. And again, there can be many reasons for emotional reactions like this. But the child will maybe often do it in play, and they'll reenact the trauma in their play and do it over and over and over in an attempt, often a futile attempt, to resolve that trauma through play. And again, play in itself, while it's helpful, isn't really the full solution, but it can give you an indication of what the child might be carrying in their body and in their mind from things that happened way before there was any memory, any conscious memory, any
Yeah, your
deliberate
explicit memory system. Yeah.
explicit memory system. Exactly. And this is an implicit system involving emotional memories and procedural memories, body memory. So, for example, uh, the expression that you never forget how to ride a bicycle. So if you think of the situation where the child is on the bicycle and the parent is right with them by their side, or an older sibling, and they go together, they walk together with the child, and then when the child gets the balance, then they let go and the child rides the bicycle for the first time. And that will then go linger for virtually for decades.
Yeah.
I mean, I started riding a bicycle again when I was in my 70s. And as soon as I got on, I knew immediately what to do. If you gave me verbal instructions, that wouldn't help. If it was written in a book, that wouldn't help. You can't learn skiing from a book. You have to experience it in your body. So
Yeah.
that's one of the keys. And these memories are sometimes called procedural memories. So, like the child on the bicycle, that will be a positive body memory and will be lasting. But what happens if the child is injured at that first attempt, or injured in some other situation in some other way? Then that procedural memory will also continue unabated until something shifts. So that something is really a lot of what somatic experiencing is about. And the question, of course, is how to work with children when they've had potentially some kind of a traumatic event. So I'm not talking about children who were abused and neglected at this point. That's different. But these are the things that happen to children routinely. They'll have their falls. They'll they'll wind up in the emergency room because they've broken because of they've gone through a plate glass window, or they've swallowed something and they need to have their stomach pumped. This can be traumatic, but if we as parents know things that we can do, we can not only minimize the likelihood of trauma occurring, but in also in providing their learning capacity for resilience, so that they'll be more resilient for that, but also for later potentially traumatic events. One of the books that I wrote with my colleague Maggie Klein is called Trauma Proofing Your Kids: A Parent's Guide for Instilling Confidence, Joy, and Resilience. And the idea here is if we help the child with some kind of a trauma, that will be lasting for them. I have a godchild, and he had a big fall, and so I sat with him afterwards and kind of helped support him through his body, and he moved through it. Then I found out later from his mother that somebody in the school at playtime also had an injury, and he went up to the child and did the same thing that I had done with him. So again, it's something also that in a very positive way is contagious. So again, in a way it's a learned skill, and it's something that children can take with them for the rest of their lives. And so that's one aspect of my work, is about prevention, not just about resolving or healing traumatic events from the past.
Well, the biggest take home from that is we understand, and maybe this is the first time our audience has heard this, that trauma is stored implicitly in body-based memories. People would say I love Bessel van der Kolk wrote the book The Body Keeps the Score, that we carry that in sensations such as smell and taste and sounds. Like there's all of these pieces, but love is also stored implicitly to experience comfort and connection.
Yes.
All of that is part of the journey, and that when parents provide comfort and connection and presence, that is also stored in the body.
Yes. Absolutely. And a child, even if a child has had a very difficult childhood where there has been a lot of trauma and also some abuse and neglect, if that child, even once in their lives, felt support, kindness, and love from an adult, that can make all the difference in the world. And for somebody where that hasn't happened, then it can be disastrous. Maybe later I can give you an example from my own experience that made that profound difference.
Yeah. Well, sorry, Peter. So when something happens to a child, maybe for instance they were hospitalized. I'll give you an example. This morning my son was in an MRI machine because he had an accident, and that can be quite disturbing to have they have to put the headphones on, and there's this big thing they have to go through, and it's making a lot of sounds. And my son's used to me walking him through certain sensory experiences, but let's get your take on it. As a parent, what might I have done so that wasn't stored as a traumatic experience in his body, or it doesn't get stuck there anyway? Does that make sense? Because it was scary. It's this, what's going to happen? Loud noise, lots of lights, that these are unfamiliar doctors.
Yeah. First of all, when any child is going to see a doctor for some kind of an invasive procedure, and the MRI is somewhat invasive, but it's not invasive in the sense that other medical interventions can have. And it's whenever possible, I think it's really important to meet the doctors before the procedure. and to see them in their regular street clothes, or but then also to see them with their surgical gowns, so they get to meet them, to talk with them. That's something that is really helpful in preparation. Now, for the MRI, again, I think what you started to say is absolutely correct. That you talk about it's going to make a lot of noise, and sometimes when a kid has gone through an MRI, I have the parents put a pair of sneakers in the dryer and then just turn the dryer on and go thump, 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 thump. And to say, and it's going to sound something like this. And they laugh at that. They laugh at that.
Yeah.
So some of the parents have reported that when that's happened, when it actually has happened, the child was just laughing and felt very playful, because they were prepared, and it was framed in a way that it was caring and supportive. And if it's possible for the parent to be in the room, that's always a value. Now, when it's going for other kind of procedure or a surgery or something like that, they usually don't let the parents go in with the child,
No.
but at least the parents can be before, when they are in the hospital. Sometimes they will allow parents to come into the surgical room, but usually not, because they're concerned if the parents would have an emotional breakdown. But if you're very solid, and sometimes physicians will allow that, but it's not something that you can count on, of course. Um, But again, these are the kind of things, again, if you give them some information that you're going to breathe into a mask and the mask is going to help you, going to go to sleep. And when you sleep, the doctor's going to help fix something that's wrong with your body. And I'll be right there when you come out. Also, to really, really lobby for somebody to be with that child when they're in the recovery room, and also when they go in for the procedure, to have one, usually it's a nurse, to say, we're going to take care of you, to remind them you'll be breathing in the mask and you'll go to sleep, and the doctors will be able to fix what's wrong, and then you'll be able to go back to school or whatever response is. And also when the child is under anesthesia, because that information does go through, to say something about, the operation went really well. You might have a little bit of a pain in your tummy in the next couple of days, but things go really well, and you're going to be feeling much better. So they're, again, giving them that message, because talking about implicit memory, the words can go in. And sometimes, and this is more with adults, but probably also with kids, is that sometimes the doctors will be carrying on these conversations, for example, about uh, a, a date that they went on with a nurse and that it was a disaster. But then the child's unconscious hears the word disaster, and that triggers again this kind of emotional, physical response in their bodies. So we really want to make sure that doctors are very careful in not doing that, and interviewing the physician before. And if you think the physician just has no interest in this, well, then maybe it's time to consider interviewing another physician. But that's, again, it's a personal choice. I
Yeah.
also
Let's.
will do
Oh, yeah. Go ahead.
so
Sorry.
I also do some of the exercise with children to help regulate the vagus nerve that we're talking about. So, and children usually really love this exercise. So remember, that's the biggest nerve in the body. The great majority are actually information coming from the guts going up to the brain. So the child is scared. They, they, the fear gets in their bodies. And so I have them do it with me, a simple exercise of taking an easy full breath, and on the exhalation making the sound "voo," as though it's coming from the belly, and then letting the sound and the breath come all the way out, go all the way out. and waiting for the next breath to come, filling belly and chest. And again, kids often love it. And if you or any of the people who are listening to the podcast want to do this with me, you are of course invited. It can usually it brings up nice sensations, but it can bring up sensations that may have, traumatic roots. But usually it's in a gentle way. So the idea, easy full breath, and I'm vibrating it here in the belly.
Yeah.
And let the breath and the sound all the way out. And then let the breath come in, filling belly and chest. And once again, and then and what are you noticing in your body? Do you feel any tingling, any vibration? Does a part of your body feel more open? And then you're helping them get reference to their bodies, which again is an extremely important part in instilling resilience.
Okay. And is this an activity you would do before and then after the procedure?
Yep, 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 yeah, absolutely.
Okay. Now imagine, now my son's
Most,
MRI was fine. Oh,
hmm, I was just going to say
well,
most of these things to do before and after.
okay. Yeah. And let's say you gave us all this lovely precursors of how we can handle medical procedures in advance. But let's say parents didn't do any of those things. And now they're kind of dealing with the aftermath of a situation that maybe wasn't handled well with the doctors or the nurse, and now they're scared of doctors, and that energy's kind of stuck. Is there a
Yeah,
way we can, the breathing exercise for sure. I recommend kids play it out. That's a huge part for me, and I like
that's
to
right.
witness the play. But is there
That's right.
anything else you would say to help move that energy out of their body so it doesn't stay stuck there?
Well, I also have them draw pictures of the hospital and the doctors and so forth, and that usually gives a pretty clear indication of where they might still need to process more material. I'm just thinking, oh yeah, I think this is actually one of the examples in the two books that we wrote, and it's called Sammy. And Sammy was visiting his grandparents, and I don't remember if he uh, broke a glass but anyhow, he was taken to the emergency room. And after that, they noticed many changes in behavior. He wasn't as bright and playful as he had been in the past, and he seemed to be more fearful. So, so we began the session, and this was at their house in Arizona, and yeah. And so we had a little a doll, one of these fluffy dolls, and we put him in the bed, and he. Oh no! The first thing is he needed to run away as soon as we brought up anything around the trauma. He needed to run away and disappear, and he ran out down towards the creek, and so I had his grandma follow him and then bring him back. Now, by doing that, he had wanted to, when he was at the emergency room, he had wanted to run away. So in this part of the exercise, he actually gets to experience running away and in a safe way. So that was one step. Then we also put the puppet or the doll in the bed, and then I think I forget exactly how we orchestrated it, but he was very much rescuing of the boy or the puppet or the doll, and each time he rescued her doll, we sang a song. Yeah, yes, the witch is dead. Something like that, so he could enjoy it, and again making play out of it. So repetitive play is not the kind of play I'm talking about, compulsive repetitive play. but play that's coming for the sense of exuberance and joy. A Parent's Guide for Instilling Confidence, Joy, and Resilience, to see if it goes from uh, a repetitive play to a more joyful play. And we give a number of exercises. One thing also that's important is that the parents take some time first to be with their own feelings and their own sensations. A lot of times when the child is injured, so they'll be crying and they've, really cut their knees, and the mother or the father yells at them, "You shouldn't have been doing this." Well, of course, the parents are doing it not because they're angry, but because they're scared. And the fear is transmitted. Children mirror the fear of adults uh, almost to a key. The child will then experience fear because of the parent's fear. There's a classical experiment where the child is going to cross this glass plate, and underneath it there's like a checkerboard, so it looks like it's height away. And if the mother, in this case, doesn't seem frightened about that, the child is first hesitant at first, but then crawls across. If the mother shows any indications of fear, the child will not move across that plate. Again, it's really important that as parents, we attend to our own anxiety or fear or whatever it is. And in the airplane, I think they sometimes still say this. They'll say the event of a unlikely depressurization. So with all of these problems that the planes are having now, you think, oh, I don't even want to think about that. But anyhow, they say the mask will come down from above, and first put the mask on your own face and breathe the oxygen. Then, if there's a child or an older person next to you, then help them with the mask. But attend first to your needs for breath, for oxygen. And I think that is really a useful rule. And again, we do some specific exercise to prepare parents for when there is something like that, a potentially traumatic event occurring, that they know that they can be confident, that they don't get stuck with their fear or anger or worry. And so then they can be present there for the child. Sometimes yes, go ahead.
Yeah, I think sometimes I know when I do trauma work with kids and they want to share something with that parent about their trauma, I typically sit with the parent first and tell them the story first, and then it's a separate session. And then I bring in the child to do it, to tell the parent the things that they want to tell them, not
Mhm.
because it's that the child's going to tell it wrong. That I want to make sure I can co-regulate that parent, that when they
Right.
hear the trauma narrative, they don't fall apart. And then that child thinks they've done something wrong, or they have to take care of the parent's emotional needs in that moment, which further suppresses the traumatic experience because they take it as a
Yeah,
perceived rejection of their story.
right. You're right on, Tammy, in being with the parents first when it's possible. Sometimes, of course, the child has an injury
No.
right away,
Yeah.
and you
Yeah.
have to intervene. But to work with the parents first and to help them regulate with you, which means they co-regulate with you. That way, it makes it much more possible for them to co-regulate with the child. Because when the parent is present, when they're there, when they show up in their own bodies, then they can be there to help co-regulate the child. And that's really what's needed. That's the most important aspect, is to help the child regulate, and do it by co-regulation. And then later on, the child will also learn how to regulate themselves, how to self-regulate themselves. But first, it has to happen in relation to a trusted other.
Okay. So part of the model for somatic experiencing, when we think of it in the framework of day-to-day parenting, of course, because that's what we're talking about. I mean, people should, I believe, if there is a lot of explicit trauma, seek mental health professional help wherever we can, but that's not always, parents don't always
Sure.
have that accessibility. But part
Yeah.
of it is that child experiencing someone who can hold space for all of their emotions, is what I'm hearing. And that parent is bringing their calm to the situation. So that child has the space to do what they need, their body needs to do, so that energy doesn't stay stuck. But that child could be prevented from doing that if the parent's dysregulated. So the parent being
Yeah.
able to keep calm during hard moments is actually a really key feature of a child processing their trauma, is what I'm hearing you
Yeah.
say.
Yes, 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 yes. And, for the parent to find calm in themselves first, and then they can mirror that for the child. And, there's a lot of this research. I'm not sure exactly if it completely applies, but there are mirror neurons in our brain, and we mirror other people. So the child or the infant, if even a pre-verbal or a nonverbal infant, they will mirror calm in the parents. So if we can then find that in ourselves and then reflect that with the child, again, their nervous system will attune to our nervous system of calm. So to help the parents first come to calm, that I think is the most important. And then to encourage them to be with the child and to mirror the calm so that the child are learning how to co-regulate with the guidance of the parent or the care provider. And so then they also learn what calm is like. I mean, that if you're with somebody who's very anxious and so forth, you will start to feel anxious. If you work with somebody who's really calm, you start feeling calm. People talk about when they met the Dalai Lama for the first time in their life, they felt calm. Well, that's because the Dalai Lama is a very calm person. And so you pick that up, and it's not that he's giving you this. Well, it is like he's giving you this gift. He's giving you this gift of how it feels like to feel calm, and the calm is something that happens in the body. It's not really primarily something that happens in the mind, but rather it happens inside of our landscape, inside of our organs, inside of our guts, inside of our heart. These are all the things that happen as an internal experience, and when we can experience that, that will be conveyed to the child or the infant. So to come to calm, to come to presence, and then to be with the child to mirror the calm. And sometimes it's only possible to do it, for example, with the child and the parent together with you, and then you can model calm with the parent, and then they can model it with the child. Because if it comes from you, the other adult, it can make a difference. But the bigger difference comes
It's
actually from the
always,
parent that they bonded with and attached with. Again, I'm not talking about situations where there was not the building of a bond and attachment, but when it needs to be supported. One of the babies that I've worked with, again, completely nonverbal, and there's an example of this in my book, Trauma and Memory: Brain and Body in Search for the Living Past, where I worked with a boy named. Oh well, I could give two examples. I could give two. I think I'll give this one first. Um, yeah, this is a 14-month-old who was born with really severe birth trauma. He was breached. He had the cord around his neck several times, so they did an emergency cesarean. And even with the cesarean, they still couldn't pull him out, so they had to use suction. And so his whole body got torqued. And he, in many ways, seems like a normal child. But you really see that he hasn't really attached to his mother. And the mother is, in Winnicott's term, the good enough mother. She's not abusive. She's a caring person. but somehow she also feels their disconnection. The reason they're coming to see me is that he's having gastric reflux, and they're afraid it'll go down into his lungs, so they want to put endoscopes, well, into the stomach and into the lungs. And for a child, a 14-month-old child who's already had pretty severe birth trauma, that could be absolutely disastrous. So I start by playing some rattles that I have, and he gets curious about that. And so I hand the rattle to him, and he reaches for it, and then he pulls his arm away, and then just, and what he's telling me is that he was overwhelmed with all of these tubes and so forth. He's not telling me that with words, because he doesn't have words, but he's telling me about it with his body. And so then I give another possibility. I again hand the rattle to him, and this time he pushes that rattle away, and you can see there's a wave of joy in his body. And then we do the same thing for his legs, because remember, when he was in breech, the more he pushed, the more he got stuck. So he then pushes against his mom's leg, and you see him just like uh, just a full blast of energy. And then he starts with having birth cries, and his mother then starts to hold him. He actually he reaches for her and wants to mold into her. And she says, he's never done this. I've never seen him cry. I've never, ever, ever seen a tear. And I don't know what to do with this. And she did know exactly what to do. And that was to, again, let him attach and let him bond. And after that, that really completely changed their relationship and the symptoms. So again, you work with preverbal or nonverbal memories through movement and through behaviors. And so again, that's one more example of working with, in this case, with a 14-month-old. But I've worked with children at all different ages, and I can also give an example of a two-year-old who almost drowned in falling into a hot tub, and he comes in. He's sitting on my rocking chair, and his legs are out like this. So I put my hand right to his feet, and he starts kicking and kicking and kicking. So that was again an incomplete response that his body wanted to do to try to kick so he could get out of that. And we go to one after another after another. And it's just wonderful to see the two of them coming to joy, because his sister, 4-year-old, also, she was the one who found him, and she went and ran for the mother and so forth. So the two of them are just doing just sliding down a sliding pond made by what do you call it, a futon in my office. So again, it's so reifying. So no, that's not the word I want. It's really rewarding to see how children come to joy as they work through the trauma motorically with their bodies without words.
If you have,
But
do you
the
think that
movement.
parents who have kids with certain like behaviors, like kids who've had a lot of trauma, often get, not always, but can get labeled with behavioral issues? And do
Sure.
you believe a lot of the, maybe it's kicking and or yelling or being combative is really what I'm hearing could be them replaying a response that went on, that fight response, for example, of when the trauma happened, and their body is just needing to engage in that, I guess, enactment. Like, but then we punish them for it. I mean, granted, of course, we have to have limits, but there is something, I think, to be said for kids will recreate these scenes, whether through play or through an interaction with the parent, where they
Or
either didn't
drawing.
get to do the thing, yeah, a drawing, but with behavior like that, when we know somatically they need to get something out of their body, but it's not
Mhm.
maybe condoned, what would you tell parents when it's?
Well, I would, first of all, a lot of so-called behavioral problems and ADHD, hyperactivity, ADHD, there are various components, but I think trauma is definitely one of the components.
Yeah. I feel the same way.
And yeah, and I encourage therapists that work with children like yourself to really see what behaviors, what feelings might have become locked in, and to work with the child. I'm not saying all the time, but a lot of the time that makes a very big difference. That they, when they can do they can do now with you, what they couldn't do then, again, that can make a big difference in those behaviors, the so-called aberrant behaviors. And again, usually the child is, wanting to do something that they were unable to do, uh, and that was what was the basis, the foundation of the trauma.
Hmm. So if it was not appropriate though, but parents like, but I know they need to do it, but we can't do that thing in the middle of a store, or we can't do that. He can't do that in class.
Right.
Would you
Yeah.
encourage it through play? Would just like to encourage that child to engage in similar behaviors, but in a playful way when they're one on one with the parent?
Yeah. And hopefully also with a therapist. But
And
yeah,
yeah.
again, Einstein said, uh, studying child's play is child's play. No, studying physics is child's play when compared to understanding child's play. Because the intricacies that come out in child's plays are, not, I wouldn't say always, but very frequently are the unfinished trauma events that occurred. And if we really learn how to read the play and notice what may have become stuck with the play, and to provide the support to help them continue with that play, that can make all the difference in the world. Truly make all the difference in the world.
Okay. And that's a good point for everyone listening. I know parents who have kids who have experienced a lot of trauma that the play sequences sometimes can be quite graphic and aggressive, and there's some yucky parts sometimes to their play that parents are uncomfortable with, so they want to say things like, but in real life we don't do that. And I always say parents, like, if it's in play and
Yeah.
as long as they're not hurting themselves or you, please let them play it out. It's okay. They need to
Yeah.
process through the sequence. We call that a play enactment. And the most
Yeah.
important thing for you is to witness it and be emotionally available and calm, was what you talked about, co-regulating them during the play.
Yes. Yes. Yeah. Again, that word has come up so many times, play. And to really see that through the child's play, they are trying to convey to us something very important. And then if we can be with them and see where that play goes, and to notice if it's repetitious. There's an example in Lenore's book, Too Scared to Cry, I think was that book, where she talks about this child, and they're playing with a toy car, and she keeps taking the toy car and banging the car into her belly, and she keeps repeating that and repeating that and repeating it. The child was sexually molested, and that's the way it was playing out. And so again, especially if it's repetitive, that's a pretty good indication that there is some kind of traumatic imprint that needs to be unpacked and to be worked through.
Mm. Yeah, I would call that post-traumatic play. In play. I'm a
Post-traumatic.
registered play therapist. Yeah, yeah, and that's those
Yep.
sequences. And we know, for any of you watching, if you're like, well, how do I know it's play or traumatic play? The affect is often very flat, meaning their emotions are very, very flat, and it almost looks like they're not deriving joy from the play. Often that's when it's really
Yeah.
quite severe trauma in the play. They're so immersed in it, and it's just it's joyless, it's the restricted, and there is something visceral about it, like a lot of energy behind it.
Yes.
And then I always know when I see those kind of elements where it's joyless, they're very serious about it, they're not involving me a lot, it's repetitive, that I'm like, some really deep stuff is coming up right
Okay.
now that they need to
Yeah.
work through.
Now, a lot of times when the child has a flat affect, what you were just describing, the parents then don't think there's anything wrong. They just think the child is behaving well. Um, but also, the child may present in the opposite way that if they come anywhere near the trauma in the play, they may start having really strong emotions. And that's more clear. And actually, in some ways, it's easier to work with.
Yeah.
But to understand that either the flat affect or the hyper emotionality can both be indications that there's trauma. It doesn't prove that there's trauma, but they can be strong indications. At least that should be pursued.
Yeah. What I'm hearing, the repetitive part is what we have
Yeah.
to pay attention to. And when we're on two really opposite ends of the spectrum, where there's hyper emotionality. So, and then more of the hypo aroused state. So the hyper arousal and the hypo arousal, kind of that window of tolerance that we talk about, that they've gone to one of two extremes within that repetition.
Yeah.
Yeah. So with your, I know you mentioned your book, Trauma Proofing Your Kids, that particular book you wrote with Maggie Klein. Is that correct?
That's correct.
Is there, yeah, if you could give just maybe one or two tidbits from that book, some strategies to give parents who, if something happens, like, I don't know, like stressful things kids go through every day, is maybe there was a lockdown at school. Those seem to happen a lot now.
Oh,
And it could have
yes.
been just a drill, but, that happened. They see horrible things on the news, like those kinds of things where we have no control. We can't prep them for these things, but
Yeah.
we can come in and try to assist them in making sure that this doesn't traumatize them.
Yeah. The thing about the news is not to keep playing the news uh, when the child is there, but to watch the news after the child has gone to bed. You know, uh, when I was in Switzerland when the 9/11 happened, and so when I came back, I was being interviewed by, I think it was one of the news channels. I think it was Fox News. And one of the things that I said about for when children see something like this, so in the news they keep replaying. It's like replaying and replaying and replaying. But the child thinks that that's happening meant more time. They don't notice it. They're just replaying the same thing. So they think that that threat is going on, and so it just feeds into their anxiety. So I said, please, and I said, I don't mean to tell people not to watch your news, but to really watch the news after the children have gone to bed, and probably don't keep watching it yourself.
Yeah.
So again, that's one thing that we can. That's a very simple thing that parents can do to reduce the likelihood of traumatization.
Okay. And in the event that they have witnessed something traumatic at school, or like a lockdown, or I know this comes up a lot, like where kids maybe haven't been a victim themselves, but something scary's happened that they've seen or been a part of. I always think lockdowns, I get asked about this all the time. So, these things happen at school that they had to hide under their desks. And even if it's a drill, kids come home just wired and disheveled, and then they don't want to go to school. But so if we're going to help kids kind of process through that, what would you tell a parent to kind of how do
Yeah.
we shake that off, literally, like out of the body, so it doesn't get stuck?
When I was in grade school, elementary school, excuse me, um, we we did this thing every day called duck and cover. So we would go underneath our desks and put our hands over our heads, I think something like that. And we were told that that was to prevent the effect of a nuclear attack. I mean, first of all, can you think of
Oh
anything
my
more stupid than to tell children they can protect themselves from a nuclear attack? I mean, maybe it has some small value because they maybe delusionally think that is actually going to protect them. But this thing about now with with school, with preparation for school shootings. I'm really almost speechless about this. I mean, you don't have this to the same degree, of course, you from the north,
Mm-mm.
but when children, know that people can come in with guns and shoot people, and then they practice these things. I think the most thing you can do is just say something like, "Sweetheart, something like this does not happen very much at all, but it is really scary." And when you feel the fear, where do you notice that fear? Can you find where that fear is in your body? So work with the somatic aspect of the fear, I think, is the most important thing that we can do. And again, it breaks my heart, that children are, told that they're having drills against, active shooters. I think it's a sad commentary on the state of some of the many rules in our country. It's it's uh,
Yeah.
it's really
So what I'm hearing is we can have like this focus on somatically where they notice it. So you might say, and they might say, my tummy hurts when I think about it, or my
yeah,
shoulders. Some kids will tell me like it hurts here. You get that stress, like a
yeah,
headache behind the eyes. Or what would you then tell them to do with it? So they've noticed the feeling. Then what? So they've noticed it.
yeah. Again, some of the exercises, for example, when the kids are holding it in their shoulders. So just have them just hold 1 second. Would you? Sorry about that.
That's okay.
You can come in. Okay, so you can splice that out.
That's fine.
Let's see, where were we?
That they notice it in their shoulders.
Oh yeah, yeah. And I said, well, if that gets even tighter, what might your shoulders want to do? And they say, oh, it'll go up to my ears like that. I said, okay, but can you do that just a little bit, one small amount at a time? So just lift them just this high and then let go. And then notice what's happening in your body. And do this 2 or 3 times. And then often there'll be bodily reactions, shaking, trembling, tears might come. And they also will feel my shoulders don't feel tight anymore. So the shoulders aren't then repeating the trauma to the child. And not just to children. That's something that that can do with adults, of course. I mean, many of the things that I recommend for kids, it's the same thing is true, or a similar thing is true with parents. Now, I think I was supposed to talk, just a few minutes about a couple of things. Is that right? Because I'm just noticing it's a couple of minutes till 12.
Yeah, and I want to
It's a
make sure we
1 hour.
talk about your book. I want to talk about your book,
Oh,
your new book. But
okay.
if people want
Yeah.
more of your exercises, is that trauma proofing your kids? Does it have some exercises in it for kids?
Yeah. Oh,
Okay.
yes. Exercises for kids and exercises for parents to
Okay.
how to not react, but to respond to the child that's
Okay.
had.
So
had
yeah, so parents, I will include a link to his book, him and Maggie Klein's book on trauma proofing your kids. And then I want to, Peter, because we only have a few minutes left, is talk about your new book that's coming out, The Autobiography of Trauma, A Healing Journey. Tell us, and when is it coming out? April? Is it April? I could have
It's
sworn it
coming
was
out April,
April.
but you can pre-order it now. Actually, it's
Pre-order it.
helpful if you do, because then it connects it with their algorithms or something like that. Um, well, we were talking about, I think, something about it's important not to just go into the trauma. Because as a child, well, I started writing this book really as an excavation for myself, because I'm now in the later part of my life. And so I really wanted to kind of see if I could weave a coherent narrative for my life, through my life. And so I wrote this just for myself. And then a close friend of mine said, you should really write this as a book, and because it can really help people heal their own wounds, their own trauma wounds. And at first, I just could not even think about doing it, because it was too vulnerable. It was, I mean, in some ways, maybe too upsetting. But hopefully also inspiring and guiding. But anyhow, when in not knowing what to do, I had the following dream, and dreams often come to me when I need information from my unconscious. And in the dream, I'm standing by an open field, and I have in my hands a, a whole bunch of typewritten pages in both hands. Obviously, some kind of a manuscript. So I'm looking from left to right, right to left, and I still am. I wouldn't say I'm paralyzed, but I'm stuck. I don't know what I should do. And then all of a sudden, there's a wind that comes from behind me and then takes the pages and scatters them into the meadow. And then I realized when I woke up that, yes, I'm going to write the book, as a book and as a guide for people to heal their own traumas. But I, um, but I don't want to go right into some of the trauma itself, because in somatic experiencing, we don't go right into the trauma. In the play with children, we don't go right into the trauma. And so the following memory came to me in writing the book. And when I was about 4 years old, it was my birthday. I guess I was 4 years old. Early in the morning or in the nighttime, my parents came into my bedroom and they laid tracks from a model train set underneath the bed, out into the room, and then back underneath the bed. And so when I woke, it was to the sound of the train going around the tracks. And I was just filled with joy. And I jumped out of bed and I went over to the transformer and I changed the speed and made the sound go whoop, whoop. And in that moment, in that memory, even though I had profound violent trauma happening after that, that helped me address that trauma in a safer way, because I knew that I was loved, that I was cared for. And again, that was an experience in my body, so I could use that experience to help support me when I worked with the violence of that time and the other problems in my childhood. So, so again, that you can pre-order the book, and I really do believe that it will serve the purpose of helping all of us, all of you, all of us, um, uh, better come to grips with what's happened to us and in our lives, not just the bad stuff that's happened, but also the things that have really connected to us in a positive way. So it's sort
Yeah.
of in a way to model
Yeah.
that. Yeah.
What I'm hearing is for any parents here who, and not just parents, but any adults, listening, who you can think back on your childhood and there was a lot of adversity for you. This might be a really good resource to help you with your healing journey. And I'm going to order it because I am a child who had a very high level of ACEs, which adverse childhood experiences.
Mhm.
So the healing journey doesn't, if you've had a really hard start in life, it is an ongoing process. We often have to come back to it little bits at a time to process everything. And it's really good to have these mentors who have walked the walk. And what I'm hearing Dr. Levine say is he not only is one of the world's top experts in healing trauma, he's done his own healing. And
Yeah.
that's the kind of leaders we want to follow, who have done the work.
Right. It's so essential to do our own work, our own healing. The archetype of Chiron, the wounded healer from Greek mythology. It's really essential that we do our own work. Otherwise, we won't be able to be present with others. We won't be able to be present with ourselves and not present with our others. So I totally agree. Also, I was asked to just mention that
Oh,
on
yes.
February 29th to March 4th, we're doing an immersion program in trauma healing. And if you go to my website, somaticexperiencing1word.com, there's information for that, and also information for the other books. I also wrote a book, Maggie and I wrote a book for therapists on children and working with childhood trauma. And this one I think is called um, Trauma Through the Eyes of a Child. Trauma
Okay.
Through the Eyes of a Child. But that's for therapists. It's a much bigger book.
Yeah,
a much
I'll put
larger
that
one.
in. I'm going to actually put a lot of this stuff in the bio so people can go to those books, like the one for therapists, the one for parents, and then your new book, The Autobiography of Trauma. So people know
Yeah,
where to find your
thanks.
work. And then your website, sematicexperiencing.com. So it has you'll have all the links so people can find your work no matter where.
Good. Thank you. Thank you. And there are trainings virtually in every part of the world in 44 different countries. So you
Yeah,
can also go.
I haven't taken your training. It's on my bucket list to do because it's quite an intensive training, and we have to travel to take it. Usually on the West Coast.
I
But
thought there were people in Edmonton had trainings there, but yeah.
oh, my colleagues have all gone to Victoria or Vancouver to do trainings, so they've always
I
had
see.
to.
Okay.
Yeah, but I would say, as speaking as a psychologist here in Canada who meets with a lot of psychologists, Dr.
Mhm.
Levine's work has, in terms of getting training in treating trauma, it's I cannot express how the positive feedback that I have received from therapists who do this training. So if you're a therapist listening, I really highly encourage you to check out Dr. Levine's work and take one of his trainings. It's intense, and it's not for the faint of heart from what I understand, because you have to be committed to your work. But the people who
Yes.
come out of that training are so equipped to work with trauma at it, especially those hard clients where a lot of it's pre-verbal or that developmental trauma. And you really get at that implicit memory system, and a lot of therapies fail to do that. So I just want to express
Right.
my
I think
appreciation.
though the training program is gentle and supportive, but to really go to the roots of trauma, of course, has its challenges. But thank you for mentioning that. And yeah.
Yeah, and I didn't mean that meaning it just takes, it's not something you're like, oh, I'm going to do a 1 day training. Intense meaning like it's a any of the
Oh,
really good therapies, you're there for several days. It's and you
that's
come back to it. That's all.
it's
It's just like my
yeah,
training and play therapy. I
right.
think
Some
that's
people,
20 days worth of training.
yeah, right. It's not like some of the therapy programs that say, "Oh, it's one weekend. You learn
Yeah.
to, do eye movements and what." But it's not. And anything that's really effective and deep takes learning and takes
Yes.
immersion. And I think that's one of the things that that training offers.
Yeah, and they
So,
can go to your
okay,
website to look
well,
for trainings in that, Peter. Can they go to your website to look for trainings in
that's
somatic experiencing?
yes, yes. It links
Okay.
to the Somatic Experiencing International program,
Okay.
and it lists therapists and also trainings in different parts of the world.
Perfect. Thank you so much. I just want to make sure everyone stays connected to your work in whatever capacity they're operating from. So thank you so much for your time today, Peter.
You're welcome, Tammy. Enjoyed the contact. Enjoyed the contact.